We all need it, health insurance. Many of us get it through our employer, but might there be better coverage elsewhere? Licensed insurance agent Kelly Parton of Health Markets can help find the answer to that question. Good morning, Kelly. Thanks for joining us today.
Good morning, Amanda. How are you?
Doing well. Hey, 'tis the season for folks to pick their plans for next year. And there might be a new group of people who are joining this open enrollment period, folks who are under the Ohio Public Employees Retirement System. Tell me what they're dealing with right now.
Well, they're dealing with losing their insurance for next year, and there's a lot of them. So I've talked to quite a few people so far, and a lot of confusion on what to do. They are getting some help with that, but we're here to help as well. We can help them navigate that mess or maze, if you want to call it, a little easier if they'd like.
Are these folks who are just, not quite ready for Medicare yet, or what? Where's this gap?
Well, these are people that have worked for OPERS. They have their pension. They are retiring, but they're under 65, so they have to find their own insurance. They are getting, help with that from the union, a stipend, but a lot of them are not sure what to do. So we just want to say, hey, we're here to help.
Yeah, and what you guys do is walk through, basically you sit down with somebody and say, let's look at your doctors, let's look at your medications, look at everybody's individual situation to see what the best fit is.
Yeah, there's quite a few options out there, especially with the OPERS people. They have quite a few options, especially with getting a stipend, which helps them pay the premium. But there's more out there than what I think most think. So we just want to put our hat in the ring and say, hey, let us help you out for free.
And this is the time to do it because open enrollment for ACA plans is going on now, correct? And they have
Right.
about a month, right?
Yeah, if you want a January 1st effective date, you have until the 15th of December to get enrolled. If you can wait a little bit, then you have until the last day is January 15th, and that would be a February 1st effective date.
Okay, but a lot of people want to be able to start off the year with coverage, so it's important
Correct.
to take a look at all of this now. Is there a lot available with these ACA plans?
There's quite a few plans out there that have better benefits than last year. There's a couple of companies that have zero deductibles. They have a high max out of pocket, but they have co-pays immediately. So that's helping a lot of people out, especially with medications.
Yeah, and speaking of medications, Medicare is another one. So open enrollment for Medicare is also going on right now, and you need all the parts for that.
Yes, you do. Yes, you do. Medicare runs until December 7th for January 1st effective date. That's the hard cutoff time. There is no any extra time to do that. So December 7th, if you want to change your Medicare Advantage plan or your prescription drug plan, you have to have it done by the 7th of December.
Okay, and again, you can sit down with folks because for folks on Medicare, their doctors and prescriptions are probably incredibly important to them.
That's number one and two. Actually, I would say number one is medication costs, and number two is your doctor. Make sure your plan has it in place. And there are changes every year. Sometimes a doctor leaves a network, and sometimes that patient is not notified. So let's make sure they're still in network for next year.
Right. You don't want to get hit with that bill. That's really surprising. Nobody
Exactly.
likes that. So
Yeah.
right now is the time to give you a call, schedule an appointment, and get set up
Please.
for next year.
Exactly. Our time is free. Just give us a call. We'll schedule it. We're booking the next week, so we're just here to help out.
Okay, good deal. As you said, it's free for you to visit with Kelly and his folks there and take advantage and make sure that you're set up good for next year. Kelly, thank you so much for joining us this morning.
Thanks for having us, Amanda.
Yep, take care. Well, stay with us for more WTOL 11 Your Day. Thank you for making us part of this Wednesday morning. We'll be right back.